All right. Okay. As Megan said, I'm currently a doctoral student in psychology. I work in the MS and migraine clinics. Today, I'll be talking about social support, kind of in general, but also with patients with MS, why it is so important. And so, really, it's kind of based off of my training year, seeing many patients and hearing their stories, and just kind of digging into the research and seeing what it says about social support. All right, so to kind of start here, looking at the biopsychosocial model, I like to kind of start with that. So even though today we're talking about social support, um, it's not just social. It really influences many, many different things. So when we think of kind of in a holistic sense, we think of biology, we think of genetics, medication side effects, social support, of course, which is the interpersonal relationships with others, but also the psychological aspect, like emotion and thought patterns and those kinds of things. So really kind of using the biopsychosocial model is kind of a nice way to holistically think of things and just know that everything really is interconnected. So even though we're talking about social support today, we're also really kind of talking about how it affects everything else and how everything else essentially affects social support as well. So it's a very dynamic process. So what is social support? It's actually not one thing, and it was kind of interesting to find out. Essentially, it's really actually made up of four kind of major components. So we can kind of break down social support in general into four different components, kind of go from there. So the first one is emotional support. And so I think that's what most people tend to think of when they hear of social support. So someone is listening to them, they're offering comfort, and really it's that general kind of empathetic nature for somebody else and how that's coming across. The next one is instrumental support. And that really is kind of the logistical side of it. So it's more of the practical side. So it's getting from point A to point B on time, providing services. If someone's not able to, for example, if they are limited based off of various reasons and they cannot do a lot of things on their own because of those circumstances, they may need to rely on others. And so that's also kind of a form of social support. It may be financial, it may be just, going from A to B, as mentioned. It may be doing chores around the house. Anything that is logistical and practical. Now, the next is informational support. So essentially, offering information to someone else that needs to make a decision. So especially in healthcare, where you're bombarded with so many different kinds of decisions, very important decisions, especially with regard to our own health, it can be kind of confusing. It can be overwhelming and a lot. And so offering information to somebody is super, super helpful because one can really only make good decisions if they have all the information. And sometimes in healthcare, information may be conflicting. It may be very broad, it may be very specific, and so it can be a lot. But I think having more information, the better off someone can be. And finally, the next one is appraisal support. So essentially, validating someone's experiences and really building that confidence. And so you'll see that over time, which is pretty common um, with social support, if it's more limited in the very beginning, and kind of seeing, how things go over time. When social support increases, their confidence builds, and whereas I'll kind of get to in the presentation, that actually affects many, many different areas of their life. And so it's not just it's not just social support, just that domain, as mentioned before, it actually affects different domains as well. So a lot of consequences of what that can do for people. So why is it important? So A lot of recent research in general for social support talks about lifestyle factors. So they talk about, drinking alcohol, they talk about smoking and all the risk factors that are associated with that. Uh, a lot of the research is actually showing that social support provides as much of a buffer, or even more so, than other lifestyle factors. And so, of course, we want to keep a lot of those lifestyle factors in check, and try to work on those if they are present. But in terms of what social support can actually do for a person, I think it's very encouraging to know that it can have a huge effect on lifestyle. Research also shows that there is a risk of poor health. And so a decreased social support, and I'll kind of get into in a bit of what that really kind of looks like. Generally, a person tends to be in poorer health. And there's all kind of reasons for that, which I'll kind of get into. Most of the research on social support, in general and also in more specific populations, is it's becoming more and more well studied. Traditionally, with the elderly is one of the major populations which research kind of focuses on, but also people with cancer as well. Now, for patients with MS, actually more research is starting to come out. And for specifically with patients with MS, what does it mean for them? And a lot of times with social support and everything else, it's measured. We use a variety of measures, and one of the top measures are quality of life surveys. So quality of life is a fairly big deal. And so it's not just the patient and symptoms, it's how's that person doing? How are they rating their quality of life in a variety of domains? So it's not, again, it's not just one aspect, but how are they doing kind of overall? Now, social support, it's not just, as I said, it's not just one thing, but the source can be from a variety of different areas. So it's not just people that we would think of, friends and family. It could also be groups that we volunteer with. It can be different kinds of coworkers, and even different kinds of support groups, for example, MS groups that tend to focus on patients with MS and their specific symptoms that are kind of going on. So really, it's not just one kind of source that has to come from. It could be a whole mixture of different sources, and so it's formal as well as informal. And especially with social support, kind of talking about patients with MS specifically. Research is tending to look at four different areas. So it's looking at resilience and adaptation. So when someone is, for example, newly diagnosed with MS, what does that look like for them? How are they adapting to that diagnosis? If they were just diagnosed, um, what's their quality of life looking like? What are their thought patterns looking like and their thought process? And how are they adjusting to to that big shift? And usually that kind of changes over time as well. And resiliency is kind of a huge factor because resiliency is, despite having maybe some symptoms that are more pronounced and more significant than others, uh, despite that, a person is still doing what they want to do and still out there living their life and continuing to do what they want to do. And so it's kind of moving forward and adjusting to things that are there, essentially doing things maybe in a more modifiable way. Autonomy is another big component. So it's that independence. So generally, we want to stay as independent as possible, especially for people with MS when some of the symptoms, if they were to change, and if there is a potential relapse, and what does that look like over time for a person? The degree of autonomy is something that patients with MS tend to think about a lot. And the next, of course, is that's related to physical health. So whether whether symptoms are visible, symptoms may not be visible. And so we know with patients with MS is how varied symptom presentation can be. And it's not always symptoms that you visually see. And so there are kind of many different presentations and a wide variety, a diverse set of what it can look like. But generally, physical health is something that is usually that is salient to many patients with MS. And finally, just the degree of social connectedness. And so this presentation is about social support and why it's so important. But research also shows that to patients, it's important, even though for some patients, they may not know what it looks like. And so that's really kind of the point of the presentation, is that it's not really one specific thing. It's actually, it can look like many different things, which can be helpful. And so social connectedness is, it's inherent to all people, but also with patients with MS, what does that look like going forward? So a lot of research is also talking about online support. And so especially with kind of COVID and all the changes that happened with that, what is online support? Is it helpful? Does it make a difference? Does it have to be in person? Social support, online can actually be fairly good, can be fairly helpful. And so especially with patients that have, that are not able to leave the home, whether it's their own mobility, whether it's contacting someone that they can rely on, or a service. If they cannot, physically leave, also if their schedule does not allow for in-person meetings and other kinds of issues and difficulties, it may not be feasible for a person to go in person consistently. And so being online can be super beneficial for that, though having to be in the same, having to actually take those steps. And it may not work for everyone. Um, so also online, there are, being in a safe space. And so especially with patients with MS, talking about, for example, fatigue, which is one of the most common symptoms for patients, and talking about fatigue with others in a shared space that's safe, that doesn't, that people understand what you're going through. And I think that can be very helpful and beneficial. So when we talk about primary and secondary symptoms, a lot of that is, again, is kind of done in that non-judgmental space, which is very helpful for patients. Um, there are primary symptoms. So those are symptoms that essentially come from MS itself. For example, fatigue. But also there are secondary symptoms, and those secondary symptoms are what come from the primary symptoms. So even though there is, for example, fatigue, which I'll kind of get into in a second, uh, what does that mean? How does that affect a person? And so the secondary symptoms are really next to it, the emotions, maybe some of the other areas that are also affected. And also importantly, research is showing that being involved with online support groups can help with treatment adherence. And so I'll talk at the very end about what that means in terms of medical care. And also just generally providing good routine and good structure. So as mentioned before, sometimes if someone can't, consistently meet in person, that it can be very difficult for a person to do that just in general. And so dealing with symptoms and maybe dealing with fatigue and all the other things that kind of go along with that, it can be very hard. And so being online can provide some kind of support structure. It's easier to do. You can do it from the comfort of your own home or place. And it provides that structure over time, which can be beneficial. A lot of times you're seeing the same people, whether it's every week, every month, every other week, every few months, or what have you. Seeing the same people over and over is beneficial for creating those friendships. So why are patients with MS more at risk for social isolation? So as kind of mentioned, there are functional limitations for certain patients. So, when we talked about the diverse presentation for MS and what that looks like, mobility can be a major issue for some patients. And so they're just not physically able to do that, whether it's getting out of the house and kind of doing their thing, it can be very limiting and hard for them to do that. Also, the disease progression and its variability. So some patients depending on how things are going. Um, the majority is relapse remitting. So what does that look like for patients? Some patients, they don't have any noticeable symptoms for years, even decades. And so for them, things are kind of moving along and they're able to kind of do things. For others, their symptoms are very significant. And so, dealing with that is usually front and center. It's the most salient aspect of them of what they're having to deal with, and that can affect them having to go out there and socialize because of the pain, because of the symptoms. So in terms of the symptoms, as I kind of mentioned, there's primary and secondary symptoms that kind of goes along with it. So the fatigue, if someone is more fatigued, makes them less likely to socialize, and also pain. So one of the most common symptoms is also pain. And there could be possibly changes in cognition. And so I'll kind of get into that more in a bit. But in terms of like, for example, following conversations, having to, we use our brains all the time, even when we don't think we are. Something as simple as following a conversation, being involved with that, interacting with others. There is a cognitive process that goes on with that as well. And a lot of studies are showing that patients with MS that have lower perceived levels of social support are at higher risk of mood disorders, for example, anxiety and depression. Patients with MS are much more likely to experience mood disorders. For really, it's for a variety of reasons. It could be, again, social support could be one of them, having that decrease. But also kind of goes, it could be the MS itself can create some of the mood symptoms. So really, it's bi-directional in terms of what that process looks like. So in terms of mood disorders, uh, thinking of what that looks like for MS patients, kind of going along with that, it may feel easier to kind of avoid other people. And so anxiety and depression, for example, if it's due to dealing with symptoms, if it's due to other areas, it's well researched that patients that have higher levels of anxiety and depression tend to socialize less. Especially with patients with MS, for example, there's some patients report kind of that constant feeling of being judged um, based on their symptoms, based on things like, for example, fatigue or pain, which other people may not visually see, but the symptoms can be there. Also, kind of the general unpredictable nature for MS. So how the disease is kind of progressing and what is it looking like. Again, it can be very different for different people. For if there are relapses or if there are symptoms that are more significant, it makes friendships with others. So really, it's that hesitation which starts to build, and that hesitation can sometimes lead to frustration. So having those decreased interactions can lead to anxiety and depression. So really, it's kind of that bi-directional relationship between mood disorders and social support. And also, it can lower self-esteem. And so, for example, not socializing can lower that self-esteem, and that essentially makes someone more likely to not socialize. And so that cycle really continues over time. Again, fatigue is one of the most common symptoms for patients with MS. Fatigue, it can look very different for different people. And so it's not just one thing. It doesn't look one specific way. And as mentioned before, fatigue is heavily involved in cognition. And so understanding what people are saying, how they're saying it, is kind of taxing on the brain at times. And with someone with fatigue, it's even more so. It can be hard to follow and process those conversations, which can lead to again lower confidence and lower self-esteem and those kinds of things. Social events in general, even though we may not think about it, are actually pretty physically and mentally draining, just in general. Having to attend something, whatever it is, having to talk to other people, it's not really just a physical aspect, it's also a mental aspect as well. It kind of requires both. Now, one of the main things that, in psychology, as we talk about this with patients, pretty consistently is behavioral pacing. So that is something that we can do that can kind of counterbalance some of these other things that are kind of going on with fatigue. So, for example, resting before and after social interactions. So some people they find that it can help to not just rest afterwards, but also rest before. And so they're kind of well prepared and they feel well rested to kind of to have those interactions with others. Avoiding cognitive overload. And so what that means is trying to remain physically present. And so we talk a lot about in psychology, breathing exercises, for example, relaxation, and those kinds of things that can help setting boundaries and not overcommitting. So sometimes people they say I have to do X, Y, Z. I have to. I need to. And using those kind of words that are absolutes. A lot of times it kind of raises a red flag in that we may not have to or need to do um, those things. And another thing is right. So it's setting those boundaries and understanding what we might be able to do and what we may not be able to do. And so just kind of understanding that difference, which can reduce stress over time, which also makes someone more likely to engage with more favorable interactions, um, which can be very helpful. And really, the interactions are manageable. And so, using behavioral pacing as a tool can be super helpful for patients. So again, kind of talking about the relationship between physical health and mental health, it really is heavily interconnected, and you can't separate the two. A lot of traditional frameworks in healthcare were before they used to kind of think of things as separate, and these days we kind of think of things as very much interconnected, and we see patients from a holistic point of view. So in general, social support can help to kind of buffer stressful events. And so life is stressful, things are going on. And patients with MS, for example, they have that and more, and they have a lot of things to kind of deal with, whether it's symptoms and fatigue and pain, those kinds of things. Social support can be helpful. So again, kind of hitting on the fact of that bidirectional relationship, research shows that patients that have higher levels of perceived social support actually have lower symptoms of anxiety and depression. And so we know that. And so that is super helpful to keep in mind. And also patients that have greater social support um, also have less suicidal thoughts, for example. They're also more likely to use different kinds of coping skills or emotional regulation strategies. So, for example, breathing is one of the main strategies that we kind of talk about in psychology, super effective and very helpful. So, patients that have higher levels of social support are more likely to use, for example, breathing exercises. So also medical care. So we kind of talked about the mental health side, but also in terms of what does that mean for compliance? What does that mean for seeing other kinds of providers, right? And so in psychology, we're kind of we've been talking about that, but also what about other providers that you would tend to see in your network? So research social support, they have a stronger network. They tend to actually go to medical appointments more often. And so they keep the medical appointments, and that helps in terms of symptom management, getting information, and those kinds of things. It also helps with medication management. So patients that have higher levels of social support are more likely to adhere to the medication schedule and see how that's going, which can be difficult for patients. And so having kind of someone to keep you accountable and those kinds of things can be helpful. And also just again going to your physician and your other medical providers to get more information is super helpful and beneficial. And also social support, it can help to create kind of a greater sense of control over managing symptoms. So in psychology, we like to talk about the symptoms themselves and our relationship to those symptoms, and how those kind of interact and go together, but also how they're slightly different. And more studies are showing that when patients, again, when they have more access to information, they're more likely to follow up with medical care. And because they're more likely to follow up with different providers, they have the most up-to-date information, and they are able to essentially make more informed decisions. So overall, social support, again, it's not just one specific thing. It really does affect behaviors. And so we just talked about medical behaviors, but for the patient themselves, there's also exercise, nutrition, and smoking. So for example, patients with social support, higher levels of social support, which they perceive, they're more likely to exercise, and they're more likely to eat well and follow kind of a more healthy diet. And they're also less likely to smoke. And not surprisingly, being part of a social network can increase motivation. And so it makes them more likely to maintain and continue doing those positive lifestyle factors. And really, again, it's kind of the holistic approach. So social support, that's one area, but it really does kind of affect many different things as well. So overall, I think kind of talking about health itself, health is not really just kind of the absence of illness or the absence of symptoms. It's much more complex than that. It's much more multidimensional. And as I've been trying to kind of hone on this concept of just that intersectionality between physical health, mental health, and social well-being. And so really that social component is super important for everyone, but especially with patients with MS. One of the most important things, hopefully, to take away from this presentation, where a lot of research now is kind of culminating and showing the fact that um, that a person's perceived level of quality of relationships is actually what's important. So a lot of times people think, well, I have, X amount of friends, I have X amount of, maybe coworkers that are friends, or I see, these other people, and they try to tally it and give a number. But what research is showing is that really the number is not what matters. It's how a person believes that the relationship is meaningful. So really, it's about the quality of those relationships and not about the quantity. So in terms of general support programs, Norton has a lot of different programs. They do a very good job of doing that, especially the Resource Center. And so Norton, they have a whole wide variety of programs for different areas. So it's not just one thing. It's not just one activity. It's many kinds of activities. And so there's really something for everyone. There's also online support groups. There's MS Connection, there's MS Friends, can do multiple sclerosis as well. The foundation has many support groups. Facebook and Reddit even are good kind of options. And so really, I think kind of shifting, it's not, it doesn't have to be only in person. It can be online as well, and it can be a hybrid. And so it doesn't have to be either or. It could actually be both. And so really kind of reaching out to others and kind of getting connected, as hopefully it's shown, is super helpful for for patients that have MS, and not just from a social standpoint, but from other standpoints as well. All right. Thank you for your time. Are there any questions?
Thank you, Rajiv. If you all have any questions, just put them in the Q&A chat box. We'll just give it a minute. And if not, then we will end this session and it will be up on YouTube in just a couple of weeks for viewing.